Good morning, students. Today's class we'll see ethics and values in nursing. Values means it is freely chosen values underlie all moral dilemmas. Though not all values are moral values. That means people value about work, family, religion, politics, money, and relationship. The important thing is that values influence decisions and action, such as nurses' ethical decision making, beliefs or attitude about worth of a person, object, idea, or action. Values and ethics are inherent in all nursing acts. Value is a strong personal belief and ideal that a person strives to uphold. That means each person have our own personal. We have a strong belief of ourselves. That is value. What we value. We value for the truth or we value for the money. Which one we gives more importance? That is the example which I am saying. That is value. That is a strong personal belief. Your values reflect cultural and social influence, relationship and personal need. Each person we develop our values through our culture, our family, our friends, our surroundings, where we brought about. These values vary among people and develop and change over time. Definition of value. Values are enduring beliefs or attitudes about the worth of a person, idea, or action. They are important because they influence decisions and actions, including nurses' ethical decision making. Components of a value. Value is set a small group of values held by an individual. A value system is an organization of values in which a set of values are ranked along with continuum from most important to least important. Value systems are basic way of life, give directions to life and form the basis of behavior. Nursing is a work of intimacy. Nursing practice requires we to be in contact with the patient physically, emotionally, psychologically and spiritually. In most the intimate relationship we chose to enter the relationship precisely because we anticipate that our values will be shared with other person. But as a nurse, we agree to provide care to our patients only on the basis of their need for our service. A value is a personal belief about worth of a given idea, attitude, custom or object that sets standards that influence the behavior. Inevitably, we will work with patients and colleagues whose values differ from us. It is not must that our values should be same with the other person. We may work with others, but our values will be exactly different. To negotiate the difference of opinion and value, it is important to be clear about our own value. What we value, why, how we respect our own values, even as we try to respect those others who value different from us. Types of values. First one is societal value. Values that are derived from society and individual subgroup. These values are heavily influenced by a person's socio-cultural environment, that is, by societal traditions, by cultural, ethnic, and religious groups, and by family and by peer group. Second is personal values. People internalize some of or all of the societal value, perceive them as a personal value. Personal values are needed to have sense of individuality. Third one is professional values that acquired during socialization into a profession. They provide foundation for nursing practice and guide the nurse's interaction with patients, colleagues, and public. Nurses' professional values are acquired from code of ethics, experience, teachers, and peers. How we develop values or how we transmit the value. An individual is not born with the values. Rather, the values are formed during the lifetime from information gathered from environment, family, and culture. As children observe the actions of others, they quickly learn what is the high and low value for them. The second term which we are going to see is ethics. Ethics are referred to a moral code of nursing and is based on obligation to service and respect for human life. Another definition by Porter Perry, code of ethics is a set of ethical principles that are accepted by all members of a profession. Code of ethics is a guideline for performance and standards and personal responsibility. In short, it shows what the nurses should do and what we should not do. Ethics is a study of conduct and character. It is concerned with determining what is good or valuable for individuals, for groups of individuals, and for society at large. Acts that have ethical reflects commitment to standards beyond personal preference. However, when decisions must be made about the healthcare, differing values and opinions among individuals can result in disagreement about the right thing to do. Understandable conflicts occur among the healthcare professionals, families, patients, friends, and people in the community about the healthcare college. Nursing ethics refers to ethical issues that occur in the nursing practice. Ethics have several meanings in common use. They refers to method of inquiry that helps the pupil to understand and the morality of human behavior. Practices or beliefs of certain groups. Expected standards of moral behavior of a particular group as described in the group's formal code of professional ethics. Bioethics is the ethics applied for human life or health. And nursing ethics refers to ethical issues that occurs in nursing practice. Terms in ethics. Autonomy. It refers to freedom from external control, right to take one's own decision. For example, when a patient faces surgery, the surgeon has obligation to review the surgical procedure, including the risk, benefits, out of respect for the patient, respect for autonomy. Second is beneficence, refers to positive actions to help others. The principle of beneficence is fundamental to the practice of nursing and medicine. Third is non-maleficence. Maleficence refers to harm or hurt. Thus, non-maleficence is the avoidance of harm or hurt. In healthcare, ethical practice involves not only we will do the good but equal commitment not to do any harm. Justice refers to fairness, the term most often used in discussions about health access to healthcare resources, including just distribution of resources. That means the people who live in the society, in the villages, or people who live in the town, they all should have a justified. That means the same degree of, same advantage, same facility of the healthcare facilities. Then fidelity. It refers to agreement to keep promise. As a nurse, we keep the promise by following through our actions and interventions. Veracity. It refers to telling the truth. Although it seems to be straightforward, in practice, that's not always clear. Accountability means answerable to oneself and others for one's own actions. Responsibility. It refers to specific accountability or liability associated with the performance of duties of particular role. Uses. Acknowledge the rightful place of individual in healthcare system. Constitute towards empowerment of individual to become responsible for their health and well-being. Contribute to quality of care. Identify obligations in practice, research and relationship. Inform the individual, family, community and other professionals about expectation of the nurse. Functions as an ethics to inform the public about minimum standards of profession, to provide a sign of profession's commitment to the public it serves, to outline the major ethical considerations of a profession, to provide general guidelines for professional behavior, and to guide a profession in the self-regulations. Then, professional code of ethics. A code of ethics is a set of guiding principles that all members of the profession should accept. It is a collective statement about groups' expectation and behavior. American Nurses Association established the first code of ethics decades ago. The ANA or American Nurses Association reviews and revises the code of ethics to reflect the change in practice. However, the basic principle of responsibility, advocacy, accountability, confidentiality remain the constant. A code of ethics is a formal statement of a group's ideals and values. It is a set of ethical principles that is shared by members of the group, reflect their moral judgments over time, and serve as a standard for their professional action. Nurses are responsible for being familiar with the code that governs their practice. Nursing code of ethics have following purpose. The first purpose, it informs the public about minimum standard of the profession and help them understand professional nursing conduct. Second, provide a sign of profession's commitment to the public it serves. Third, outline the major ethical consideration of the profession. Provide ethical standard for professional behavior. Guide the profession in self-regulation. And remind the nurses the special responsibility they assume when caring the sick. Advocacy. Advocacy refers, these are some of the terms which we more oftenly used in ethics. One is advocacy. It refers to support of a particular cause. As an advocate, we advocate for health, safety and rights of the patient, including the right to privacy. Second is responsibility. We have already seen the responsibility. Accountability. Accountability means we are answerable to our own actions. We learn to ensure that professional actions explainable to our patients and employer. Healthcare institutions also exercise accountability by monitoring individual institutional compliance with the national standards established agencies like Joint Commissions and AMA. Confidentiality. This term, widely respected term in healthcare, it ensures protection of patients' personal health information. That means whatever the health in the matter, the patient which tells us should be confident. It should not be talked to everyone in whom we come in contact. The ICN, International Council of Nurses, Code of Ethics for Nurses, have four principal elements. They are nurse and people. The first one, nurse and people. The nurse's primary professional responsibility is to people requiring the nursing care. In providing care, the nurse promotes an environment in which human rights, values, customs, spiritual beliefs of the individual, family and community are respected. The nurse ensures the individual receives sufficient information on which to base the consent for care and treatment. The nurse holds a confident personal information and uses judgment in sharing this information. The nurse shares with society the responsibility for initiating and supporting action to meet the health and social needs of the public, in particular those of vulnerable population. The nurse also shares responsibility to sustain and protect natural environment from depletion, pollution, degradation and destruction. Second is nurse and practice. Nurse carries personal responsibility and accountability for nursing practice and for maintaining competence by continual learning. The nurse maintains a standard of personal health such as ability to provide care is not compromised. Nurse use judgment regarding individual competence when accepting and delegating responsibility. The nurse at all times maintains standards of personal conduct which reflect well on the profession and enhance public confidence. The nurse in providing care ensures that use of technology and scientific advances are compatible with safety, dignity and rights of people. The third one is nurse and profession. The nurse assumes major role in determining and implementing acceptable standards of clinical nursing practice, management, research and education. The nurse is active in developing core of research-based professional knowledge. The nurse acting through the professional organization participates in creating, maintaining safe, equitable social and economic working conditions in nursing. And last, nurse and co-workers. Nurse sustain cooperative relationship with co-workers in nursing and other fields. Nurse takes appropriate action to safeguard individuals, families, communities when the health is endangered by a co-worker or any other person. Nurse and society participate and share responsibility with other citizens and other health professionals, recognize and perform duties of citizenship, aware of laws and regulations which affect the practice of medicine and nursing. Legal consideration. First nursing law was formed in 1903, Indian Nursing Council Act enacted in 1947, amendment in 1957, torts land. Torts means are when others interfere in individual's privacy. Assault means occurs when a person puts another person in fear of a harmful or offensive contact. Battery, it is intentional touching of another body without others' consent. Negligence, it is described a lack of proper care and attention, carelessness. Malpractice, failure to meet the standard of acceptable care which result in harm to another person. Fraud, it results from deliberate deception in order to produce unlawful gains. False imprisonment. It occurs when a client is not allowed to leave the healthcare facility when there is no legal justification to detain the client or when restraining devices are used without an appropriate clinical need. Invasion of privacy. It includes violating confidentiality, including on private client for family matters and sharing the client information with unauthorized person. Nursing liabilities and preventive measures. All nursing observations should be noted carefully, described accurately. Patient's complaints should be recorded as accurately and specifically. Nurse must report to the proper channels. Or the authorities must be informed regarding any kind of equipment, materials, supplies which are of any reasons less than safe for use in the patient care. Insurance protection. Thank you for listening.